Hi everyone, welcome back to the channel. I am Chidera, a Preassessment Endoscopy Nurse. If you've ever been curious about working in the field of endoscopy, or you want to make a career switch from one aspect of nursing to a specialized area, or you are that individual who wants to know what really transpires within endoscopy, this video is for you. In today's video, I will be talking about the various career paths in endoscopy and their responsibilities. So if you're a student nurse, a practicing nurse, or that individual, like I said, who wants to know what happens within the endoscopy setting, then you are on the right channel. Welcome back to this channel. And if this video is of immense benefit to you, then I will appreciate if you like, share, and subscribe to this channel. Also, you click on the notification button to get more notification when I release new videos. So let's dive in. First up on the roles in endoscopy is the endoscopy nurse. This is the most essential part of endoscopy in the sense that we assist the doctors and ensure that the patients are ready and prepared for this procedure. So the endoscopy nurse, the responsibility of the endoscopy nurse includes making the patient comfortable, preparing the patient, admitting the patient, and setting up the instrument in the room before the procedure commences. It is also the responsibility of the endoscopy nurse to monitor the patient during the procedure, administer medication where and when needed. We also ensure that the patients are properly discharged and are given their post-procedural or post-operative information and aftercare. To become an endoscopy nurse, you need to have your registered nursing qualification. Yes, that's the first step. You need to be duly qualified as a registered nurse with interest in gastroenterology, surgical nursing, or you must have practiced in the surgical wards. Also, you mustn't have any experience in endoscopy to work in endoscopy. There is a hands-on training, there are qualifications, there are trainings that you could be put through if your interest is to work in endoscopy. All you need is a passion as a nurse to work in endoscopy. It's a very nice area to work in, and I've been here a very long time. The next set of people who work in endoscopy are the pre-assessment endoscopy nurse, which is what I actually do. It's a responsibility to prepare the patients, assess the patients, carry out a health assessment on this patient before they come in for the actual procedure. This could be done virtually or in person. So what are the responsibility of the pre-assessment endoscopy nurse? The pre-assessment endoscopy nurse carries out a health assessment of the patient. We carry out a surgical assessment, medical assessment, medication review to ensure that the necessary adjustments are made on the patient's drugs. This is to ensure that the patient is safe. And we educate those patients on their dietary restrictions and their bowel preparation. So these are some of the things we do. We also ensure that we identify potential complications and stop them in the track before they come in for the procedure. So what are the qualifications you need to work as a pre-assessment endoscopy nurse? You need to have worked in endoscopy for a while. You also need to have a good communication skill, which is a soft skill that you need to develop because communication is necessary when you are assessing this patient in view of their colonoscopy. Also, within the endoscopy setting, we've got the endoscopists. These are the doctors who perform the procedure. Well, in current times, it is not only the responsibility of the doctors to perform endoscopy. We've got nurses who are now clinical endoscopists trained to perform endoscopic procedures. A nice area, a highly rewarding area, I must tell you. So what are the responsibilities of the endoscopists? They perform the endoscopic procedure, ERCP, colonoscopy, flexible sigmoidoscopy, gastroscopy, and the rest of them. They are also trained to take biopsies, take out polyps, carry out bowel cancer screening, draw up medical plan and surgical plan for patients who will need further care. They also ensure that the patients are properly discharged, especially when when these patients are going through a complex discharge pathway. So these are some of the things that the endoscopists do. And the qualifications: to be an endoscopist, you need to have been trained as a medical doctor. You need to have been trained as a registered nurse who have worked in endoscopy, like I said earlier on. You must have undergone training in endoscopy. You must have an experience in surgery. You must have an experience in gastroenterology to work as an endoscopist. The next set of people in endoscopy are the endoscopic technician, otherwise known as the endoscopy support workers. You do not need a degree to work as an endoscopic support worker. All you need is to have been exposed to medical technology, or you have worked as a healthcare assistant. So what are the responsibilities of the endoscopy technician? They are very essential people in endoscopy because they are wonderful people. They help to sterilize and prepare the scope. They help to ensure that they help the medical team to set up the equipment in the room. One more other thing they do is that they troubleshoot technical glitches that happen when in the process of performing an endoscopic procedure. So there are various areas in endoscopy that I cannot exhaust in this video. We've got the clinical nurse specialists, those who are specialized in inflammatory bowel disease. We've got the stomach nurses. We've got the upper GI CNS clinical nurse specialists. We've got the lower GI clinical nurse specialists. We've got the research nurses in endoscopy. We've got the nurse managers. We've got the practice education facilitators, those who train newly qualified nurses in endoscopy. So this is a very highly specialized area, wonderful people working in the field. So if this is an area of interest for you, then you could consider working in endoscopy. It's highly rewarding and it's highly engaging to work in. So if you're thinking of joining the endoscopy team, I would like you, if you drop a comment in the comment section on what area interests you from this video. And if this video has been of immense help and benefit to you, I would appreciate if you like, share and subscribe to the channel. And also don't forget to click on the notification button, as I will be bringing more videos your way with regards to the Bowel Chronicles. Until I see you in my next video, keep safe and stay good.